What we are looking to do through FoodRX is to partner with healthcare organizations throughout our territory, and with those healthcare partners have them identify patients that attend their clinics who are food insecure. And then upon identifying those food insecure patients, we then look at diet-related disease conditions that those patients may have, and then develop a food intervention to provide healthy food for those patients.
What a great idea this has been. What a revolutionary concept to address one of the main social determinants of health for our patients. Food deserts, lack of food, the ability to go buy fruits, produce. So what we know is that if we are addressing one thing with the patient, we've got to provide them a sales pitch, if you would say, to get the whole family to buy in to the new food philosophy approach, right? I can fix your diabetes, but I want everyone to have good blood sugars in your family.
While we as providers do encourage patients to choose nutritious foods and engage in regular exercise, having the FoodRX pantry on site at our Fletcher location makes it possible for our team to address the co-occurring concerns, the health conditions, and the food insecurity in real time.
Another key proponent of FoodRX is looking at clinical outcomes. So in the case of diabetes, for example, the partner will measure A1C of the patient in the beginning, which is blood sugar levels basically. And then, after the period of the intervention, whether it's 12 weeks or 6 months or a year, we'll measure A1C again. And the expectation is to see that number improve.
A lot of providers, of course, we address their needs in the moment. We're making sure that we're prescribing the medications appropriately and trying to provide as much nutritional education as possible. But taking it this step further is providing patients with the actual resources in hand before they leave the office, better education, and the actual foods necessary to improve their health outcomes.
So this concept could not have come at a better time. We are so fortunate to have this food pantry downstairs. I love going and seeing it. I love seeing the activity between the case manager, the providers, the excitement the patients get to understand that this is not a one and done. This is a journey.
This is a prescription for healthy food, that learning how to eat these foods, incorporating these foods into your diet can reduce the amounts of medication that you're taking in the long run, can extend your life. It's not just getting food out into the community, but it's getting healthier food out into the community and getting it in front of people who probably may not have otherwise been eating this way.
As a primary care, I'm seeing their blood sugars are improving, their weight is improving, but their knowledge is improving of the foods they eat, of their medications, and of the disease process altogether.
And I cannot tell you the excitement that I see in the eyes of the patients and the case manager that's running the program. I mean, just the work that we've done here in the last few months has just been outstanding.